Hey, don't make fun of my name.
Tonight's topic is euthanasia. We support that terminally ill patients should have the right to have physician-assisted euthanasia. Euthanasia is the practice of ending a life in a manner which relieves pain and suffering. The significance of our argument tonight is that a person in unbearable pain has the right to end that pain with death. Also, that people should be able to decide when their quality of life is not sufficient enough to continue on with living. Drug-induced relaxation and coping with the pain is not a dignified way to live. Robert L. Fine from Baylor University Medical Center interviewed many patients in the medical center. He summarized that patients, even though they're on hospitalized care such as antidepressants and pain relievers, patients still complain that they really felt no point of all these medications put within them, because they still felt sadness, a loss of energy, and sleep disturbance, and recurring thoughts about death. The inherency of this argument is that the current policy of constantly aiding the pain with drugs and psychological coping is an indirect way of dealing of the problem of suffering. This method provided by hospitalized care and whereas end-of-life corporation is avoiding the curing of the pain and intoxicating the patient enough to despise the pain itself. This ineffectiveness is shown by John and Morris by the Brown University Center of Healthcare Research. Another survey of all patients in the hospital with inpatient hospitalized care said only 16% were pain-free in the last 2 weeks of their lives. This shows that palliative medical care and hospitalized were inefficient in revealing pain in the last few moments. The solvency of our argument is that a policy of euthanasia that is currently active is Oregon's 1997 Death with Dignity Act. This contains a mentally capable adult resident who has been diagnosed by a physician with a terminal disease that will kill the patient in 6 months. With the request from his physician, the prescription of a lethal dose of medication for the purpose of ending the patient's life. The exercise of this option under law is voluntary, and the patient must initiate the request. Any pharmacist, physician, or healthcare provider who has more objections may refuse to participate. With this act, this prevents involuntary euthanasia, known as death penalty and the death panel. And also, since the patient has to be mentally capable of deciding that he wants euthanasia, this prevents like other families wanting euthanasia on that patient. And then a summary from the Oregon Medical Board from 1997 to 2008, when the act started, it showed that 81% of patients had cancer, around 8% had brain disease, 5% had lung disease, 2 of them had HIV/AIDS, 1% had heart disease, and the other 2.5% were miscellaneous tissue/organ diseases. These percentages were the euthanasia enactors within the 1997 to 2008 year. This shows that all patients that receive euthanasia by their doctors did not abuse the system for unnecessary diseases. So with these 3 reasons that euthanasia should be, this should say that all patients have a right to have physician-assisted euthanasia.